going on, guys? So I do a video while I'm running about running. Why not? Hopefully don't get too motion sick. So I see a lot of patients that get pretty frustrated about why their injuries aren't changing faster. Is this something they're gonna have to deal with? Why the injury come about without trauma? I'm talking particularly about runners here. So I'll use an example from yesterday. We had somebody that's run casually probably for the past 20 years since college. Always had a somewhat constant complaint of left knee pain that always gets worse with increase in volume or intensity. So as they want to train for a half marathon or a marathon 50K, now they got their sights set on a 50 miler, this becomes very acute left lateral knee pain that sits them out, but it subsides within 24 hours every time. So what we have to get people to understand is a couple things. That would be what we would title or define as pathomechanical pain, right? The mechanics of what we're doing are driving the pain, which means they may not necessarily be driving pathology, right? They may not be causing tissue damage, may not be causing a muscular strain or a ligamentous or tendinous sprain, right? We're not outpacing capacity necessarily. Sometimes we are. So if we're trying to change pathomechanics, right, mechanics that are quote unquote bad, it takes a long time. And when we're talking about endurance sports, it takes a long time to get good at them for two reasons. Research shows the earlier age I start running, better off I do because I build a bigger aerobic base. I actually make cellular changes, both epigenetically and just biologically, in my mitochondria to where they become more efficient. I get more dense bed of mitochondria as well, some more, which I need right now going uphill. But every time we go run, our body gets worse at running to a certain point. What do I mean by that? Well, if I just run, which is what a lot of runners do, turnaround point, excuse me, you gotta learn how to do a good farmer's blow if you're gonna be a good runner. So every time I run, my body's trying to become as efficient as possible. Efficiency is king in running or any endurance sport. So the path of least resistance equals efficiency. The path of least resistance for each individual is different and will be determined by a lot of factors. But if we're talking about mechanics, mobility, right? What can the tissue and joint do? Stability, how can you control that mobility? And then that kind of gets over into technique. How do I use those things? So if I keep up in my volume and I keep having pain in the same place every time, it's kind of like your body's wanting to go back to default mode. And if I want to change default mode, it takes a lot of freaking work. So people get frustrated when they say, man, I get this left lateral knee pain. What specific exercise do I need to do? You know, I've done massage. I've got adjusted. I think my hips are back in line. What should I do? You got to break that pattern. And the only time we label a pattern as pathomechanical, technically, is if it's causing pain. So I've mentioned this numerous times, but mechanics could look awful, but if it's not causing pain, should we necessarily change it? A lot of factors to consider there. So, all that said, if you're dealing with pain that's really just surrounding your activity, take running for this example, it really doesn't affect you in anything else. That doesn't mean we got to change your running. We need to change the machine that's doing the running. All right, we've got to give the ability. That means maybe creating more mobility, creating better tissue tolerance. Then we got to create capability. All right, I've got to be able to control and do over time repeatedly. And in my opinion, one of the best ways to throw a constant curveball at your body wanting to become as efficient as possible and maybe falling into bad patterns for endurance athletes is cross training. Moving in different ranges of motion, right? Not just the sagittal plane, which I'm running in now, but side to side, coronal, and also the transverse, so rotation, which a lot of runners need a little more of. So when I'm cross training, two things. I'll use Stanford University as an example. Stanford doesn't usually allow music to be played when they're working out because they actually want their athlete's head in the workout. They want their awareness level through the roof, because when we're training, cross training, we're working on getting better at movement, not just moving more. We do that enough in basketball and football and running. We're trying to clean up movements, right? Build strength on top of a clean movement. Build stability on a old injury that wants to fall back into those default patterns that causes pain. So awareness has to go through the roof. I can't tell you how many people, when they're in the office or going through drills, are like, man, if I just really think about what I'm doing, I don't have any pain. Ding, 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 ding. Yeah, you gotta think. So I think in those cross-training sessions, right, when I'm lifting weights, working on movement, whatever you want to call it. So when I'm out here on the trail or on the road or on the court or on the field, I don't have to think as much. It's default, right? I'm building a default pattern. Subconsciously, it's so ingrained now that it's different, right? It doesn't cause me pain. And that is my option. So just like I'm running by this creek here, it could be called a crick, depending on where you're from. That creek is going to take the path of least resistance unless something or someone alters it. That's all rehab is. Redirecting the course 9 times out of 10. Sometimes, yeah, we got to get stuff to heal that's been injured. I think that's rarely the case, in particular with what I see, especially if we want to call it like a chronic repetitive use or strain injury. So I hope that helps some people not feel so maybe depressed or chained down to pain that's been nagging them forever. Sometimes you got to figure out exactly what you need to be able to do, and then be able to do way more of that more often with more load, and maybe even with a coach thrown in there. I got to get the rest of this run in. See ya.